Yeah, hi, Dr. Shabin. How are you?
Good evening.
Good
Am I
evening, good
audible?
evening.
Hello.
Yes, yes.
Sorry,
Hi,
Taguhi.
Mr. Taguhi.
Barret Shabin Nazar.
Taganil kiss barevela. Mia tanklar no barevi.
Hello. So sorry.
Hi.
Place. So are these the students or parents? Do you have any idea?
Yeah, most of them are parents, yeah, as of
Awesome.
now.
So I
Yeah.
think it's better you let them know. Like we'll take few minutes for
Yeah, we can wait for like
everyone to join.
2, 3 minutes and
Okay.
Everyone.
yeah.
I think most of them are just opening their fast as well, right?
Yes, yes,
So
yes. It's Ramadan here, so
I can
a few
imagine.
of them, yeah, they might be going for prayer and all. So
Uh-huh.
we'll just give them like 1 or 2 minutes.
Oh yeah, please. That will be perfect. And
Good evening,
Yeah, hi, Deep.
everyone.
Hello.
hi,
Hi.
Deep.
Hello.
Is
Hello.
Deep one of the team member or is he a student?
He is a student.
Oh, that's awesome. I'm very happy when I see students coming in and turning on their camera. It's very comfortable to see faces. Thank
Yeah,
you, Deep.
most of them
So very
don't, yeah.
from yeah, they don't. It's very hard to get those students nowadays. So Deep, where are you from?
I'm from Kolkata.
Kolkata, also. So Shasin, at what time are we starting? How many minutes are we taking? Are we going in at
Just
9:30?
Yeah, just 1 more minute left. Yeah, it's time here.
Okay. Just keep an eye. I think it would be the best to keep an eye on if people are coming in.
Sure. So, I think I'll just, start with the presentation. Like,
ബിജിന്റെ വൈഫൈ കാണാനേ ഇല്ല എനിക്ക് എനിക്കറിയത്തില്ലേ അതിനാ
Miss
അത് ഇത്രേ
Julie,
ഉള്ളൂ
Miss Julie, your microphone is turned on. Microphone on, ആണ്. It happens.
yeah, yeah. Can you guys see the screen now? I'm sharing the
Yes,
screen.
Yes,
all
sir.
good.
It is visible, yeah. Great, great.
You can start with an intro from your end and take things forward.
Yeah, I think there are a few more people joining.
I think you can make one of your team member a host. So, even if others are joining in
Okay,
between when you're presenting, it'll be easy for you.
okay, I'll do that. Yeah, Tasneem, I'm making you the host. Or
All right, Shazin.
all right, all right. So you can admit the remaining people. Yes. So yeah, I've given you the access. Got it, yeah.
Um,
Okay, I
Host
think
kindly,
we're good to start, yeah.
yeah, and also could the host keep an eye on the microphone? So if someone is turning it on by mistake, you can mute them. I think the host can do that.
Yeah, the host can mute everyone, yeah.
That's it.
Yeah, Shazin, I'll take a note on that.
Okay, great. So yeah, I think we'll start with the presentation. Yeah.
Are we starting now? Or
Yeah, we can start now. So yeah, hello everyone. Welcome. This is a general webinar on MBBS from Armenia. We have Dr. Shabin here along with Ms. Taguhi. So Dr. Shabin, he is a clinical psychologist from US. He is a co-founder of a university in Armenia called Royal Victorian University. And he's also Foreign Affairs Director of UTMA, University of Traditional Medicine in Armenia. It's a medical school, so you'll get to know more about the university and the course details later in the presentation. And we have Ms. Taguhi. Welcome. She is the International Admission Officer of the university. So yeah, I think I'll just begin with the presentation.
Okay.
So yeah, MBBS in Armenia, we have a very good tie-up with University of Traditional Medicine of Armenia. So we've been working with this university for a while, and so we'll just get into the program. Like, I'll just give you guys a brief about how the program is going to be, like the duration of the program and everything. So as you all know, the MBBS outside, like MBBS outside of India, it's mostly called MD. It's Doctor of Medicine. So it's 6 years. So in those 6 years, the first 3 years, it will be mostly theoretical. It will be like, an advanced version of your grade 12 science, basically. And after the 3 years, it's going to be completely practical. So the students, they'll be practicing alongside their teachers or professors who are mostly doctors in the universities, or I mean in the hospitals around. So they'll be getting hands-on experience while they're working, while they're studying. And the syllabus they follow is European syllabus. It's one of the most widely used syllabus in the world, and most countries, they follow this syllabus only. And yeah, the main highlight about this program is that the clinical exposure that the students get, while studying in MBBS, how important it is to have a hands-on experience, like, because you're the ones who's going to be in touch with the with the patients. So you're going to have a first-hand experience with the patients. So with this university, you can actually witness first-hand experience along with your professors who are doctors in those universities. Yeah, was someone saying something? Okay. So the next highlight about this, about the programs in Armenia, the MD programs in Armenia, is that they get exposed to cadaveric learning. So most countries, they don't have that license to explore cadaveric learning. They use dummies for practice. Even the country we are in UAE also, like, they use prosthetics for practice. But here, what makes India stand out as one of the best MBBS in the world is because of cadaveric learning only. So you get the same kind of exposure in Armenia because they have the authority to do it. And one of the, why Armenian MBBS is, one of the most popular MBBS in the world is because of its affordability. So they have this tagline, which is making education attainable for all. So it means, regardless of what background you're from, nothing should stop you from getting a very valuable or high quality education. So even a country, when it comes to country like Armenia, the living cost, the fees, everything is remarkably, like, very affordable. So which means you get to do your MBBS, I mean, do your studies without, any financial burdens. And coming to the progression routes. So once you complete this program, this universities, they have like, very good accreditations with most, medical bodies of the world, like WHO, ECFMG, MCC from Canada, all these countries. So once they complete the program, they get to explore, if they want to go for masters in a country abroad like Canada or US or UAE, they have the access to it. And if they want to get the licensing for a country abroad, they just need to give the licensing exam in the particular country. Say, for instance, if you want to go to US, you can just attempt USMLE exam, and you have to crack it, of course. And same thing with UK, you have to do the PLAB exam. And Germany, as you know, they give free education. So we also have an in-house our own German language course. So interested students who wants to go to Germany to pursue higher studies, they can they can do our German language program and then progress to a university in Germany. And yeah, so coming to Smartzett Academy. So Smartzett Academy is actually a part of Smart Travel Group. And Smart Travel Group, they have like around 11 branches in UAE and India. And we facilitate all these options like overseas education, soft skills training, like many of you might know already. And so the universities that we do, as I mentioned earlier, they have WHO approval, which is one of the most important element in this. And it's also approved by NMC. So as you all know, like most of the students we have are from India. So they will be wishing to go back to India for their licensing exam or post-graduation or anything. So since they have the recognition from National Medical Commission, which was previously known as MCI, most of you might be familiar with MCI, Medical Council of India. So they get to practice in India after completing the exam. After completing the course. And these universities, they have very much experienced staff and they also have staff, professors who are already in the field. So they get to experience firsthand, exposure with them. And they have like, high-tech lab facilities and everything. And the main highlight about Armenia, which makes Armenian MBBS different, is because lower student staff ratio. So these universities, especially UTMA, they have a limit of number of students, because as you all know, you need a very good exposure with the patients while you are from the third year. So after completing the third year, you get to practice. So if there are a lot of students here, in a university, they cannot get the exposure, because that is why the universities, they keep the number of students very less. So they have their own, facilities for that. So yeah, these are everything that we mentioned earlier, like about the progression routes and everything. So these are the accreditations, mainly World Health Organization, National Medical Commission, accreditation, ECFMG, and even MCC from Canada. So it means once you complete the course, you are getting access, an international access. So you get to do post-graduation or for practice or licensing anywhere in the world. So this is where we come into the picture. So from the first step, which is the eligibility assessment, we will be taking care of that part, like if the student is eligible for it or not, and student counseling, document assistance, submitting the application, the fee payment process, visa processing. Because as a part of Smart Travel Group, processing the visa or ticketing, all these things we've been doing for a while. So we are very much confident that we can continue to do so. And we also have this pre-departure orientation and post-arrival assistance as well. So including airport pickups, everything like getting extra baggage, student discounts, everything will be taken care by us, even the medical insurance and everything. So yeah, that's pretty much it. So if any of you has any doubt about the presentation, yeah, please go ahead. I think I'll pass on the presentation to Dr. Shabin.
Thank you, Shasin. That was very brief and that was awesome. Thank you. So if you could just end the presentation, it will be good so I can see people in. And hi, everyone. Very good evening. I do understand most of you folks must be tired and some of you have just opened up the fast. And I think we have a mixed crowd from UAE and other places back in India. Or if there is anyone from elsewhere, please let me know. Thank you, Shasin, once again for presenting. Am I audible for all? The connection is good? Awesome. Good so
good.
That's great. That's great to know. So as Shasin was giving you some brief about, about UTMA, and I would like to add in some points about Armenia, and Ms. Taguhi is also here, and she have a very good experience working with Indian students. And I think that's definitely going to be some insightful communication or conversation that we are going to have. So to start with, I would give you a small brief about what the course is and how much time it takes or what's the journey like. So I myself have done it, been through it, and I passed out in 2018. So I can be of that first-hand experience and giving you an insight about how it's been. And in single word, it's been awesome and still loving it. And definitely the reason why I'm still connected to the roots of Armenia. And so about UTMA, UTMA is a university that's been around more than for 30 years with a great background working with students from various nationalities. We have more than 20 different nationalities studying with us right now. Most of them who are basically from India, of course, from all over the world. Most of the medical students are from India. So considering the ratio, it's very natural. So the course is a 6-year course. It is fully in English, and the course is an MD physician course, which usually we say it in India as MBBS course or general medicine. But there is definitely like more opportunities and more courses to study in the course. Because a MD physician degree that's based in European syllabus is more than what is in India. So this course is accredited and recognized around the world. For example, in the US, UK, Canada, whichever country you want to go or move in, there is lots of opportunities because of it. For example, let's say, to study German language, it's not a difficult thing when you do it. So if you're finishing up your German language program, there's an opportunity for you to do your post-graduation for free. So let's say a student who finishes in the 4th year, they can join the German language course. By 6th year, you are an expert in German language. Not only you are moving to Germany as a doctor, you are also, say by that time, you are looking for an alliance, you have a spouse, definitely they are also taken care, even their education is free. So the opportunities what we give through UTMA is not just for your current situation or just for your current interest, but we look at a long-term vision and goal to make sure all our students are having a career and a secured future. So that's how we work. And coming into the basic things, all the parents want to know some things that's very important. First thing, starting with safety. So Armenia is a very safe place, very good community, great amount of quality people living in the region. And India is one of the favorite countries for them. Starting with, let's say, they have Taguhi, like how many Indian serials are played in a day over there? Is it 4 or 5 now? Like Indian serials, Sankakan Kinonada, Kanya Tarinum, Amano.
Okay, maybe more than 5.
Okay, so you understand there is more than 5 Indian serials played in a day. So you can imagine how much the people love Indian culture and our people. So they are super friendly, and it's really secured for girls, boys, and everyone who is there. And we do have something very different from all the other universities. That is a local guardian who is one of our partners in the university. And he'll be there, Mr. Ashok, he'll be there taking care of the students, ensuring their safety and ensuring the communication is open with the parents and the students. Because unlike other universities where you go there won't be a communication with the university partners, or there won't be a communication with the university authorities when you need them. So here you have a local guardian who is going to be a parental guardian in Armenia. And we have a students council that's going to be ensuring the students are safe. We are the only ragging-free campus in medical schools. If you check around the world, we are probably one of the only medical school that's completely ragging-free and secured for the students. So we are very proud of it, because we have a students council that's registered. It's called Indian Students Welfare Association. It's registered with the Embassy of India, and we are very proud to have them. And it's mostly run by seniors and the students who will be joining in later. So these are some of the benefits that we have. The hostel facilities are very close. We have Indian food available. If you come to the educational aspect, we look at quality more than quantity. So that's why we keep our number of admissions in a year to 120. We do have the provision to take more, but we keep it at 120 with the focus of having, per teachers, how many students they can attend and how much square feet is given to each student. And at the same time, how much of time a student is going to have with hands-on exposure in the hospitals, cycles, etc. So considering all the quality aspects, we are one of the best universities currently. And all our students have been providing really good output. And in simple ways, I can say it's a great opportunity. And if you have doubts, you can always ask me. You can write it here in the chat, or you can just ask us. And I would like to also allow Ms. Taguhi to giving some thoughts about how it's been for Indian students and how her experience is working with Indians. So if there are other nationalities, it's the same. I just want to give the Indian, especially because it's more of the crowd here. So Ms. Taguhi, over to you.
Okay, so good evening, everyone. Nice to meet you all. I'm really happy to be here at the moment and to have this conversation with you. It's already about 1 year or more than a year since I'm working with Indian students, and it's really a great experience for me because this is a kind of mixture of Armenian and Indian culture, so I like it very much. What I would like to say is that all your rights will be protected here in Armenia, because the country is really safe and the country takes total care of the students and the University of Traditional Medicine as well. So you will always feel at home here. You will not have any problems. And if you have any doubts, you can come to our office, which is always ready to support you and provide you care and support. And as Mr. Shabin already mentioned, the country is really safe, so your parents don't have to worry. The university is really a good university, and you can study here at an affordable price. It's really difficult in these days to find such a university which provides not only good education, but also an affordable price and a lot of opportunities. But this university, the University of Traditional Medicine of Armenia, does this. So what else to add? If you have any questions regarding the university, regarding our office and other procedures, feel free to ask. Mr. Shabin, I can't hear your voice.
Thank you, Ms. Taguhi. I appreciate that. So usually, I was just saying, usually we have certain questions that's very common with the parents, starting with, what's the cost of education. For that, I would say the team counselors will be reaching out to you with a brief, because there is a lot to brief and there will be a lot more questions for you. So I think one of the team member from Smartzett Academy will be reaching out, right, Shasin?
Yes. Regarding the fees and the admission procedure, we'll be taking complete care of it. You can just connect with any of our counselors and we are ready to help.
Yeah, if you could put in your numbers, if you're interested, you can reach out, or if there is a contact number, please let everyone know, Shasin. You can type it in the group. And there is something usually people ask about NEET. We can discuss about that. If you have any questions, please pop out. Deep, since you are the only person I see on the screen, I think it will be easy for me to communicate with you. If you have any questions, feel free to ask.
Yeah, I have one question that,
please.
According to you, there are 6 years of this course. They are having European syllabus.
Yes.
But the degree is Indian MBBS which they are providing, right?
No, it's the same in Europe and in India. Just the syllabus is different, and as long as it's accredited by FAML, it's accepted in India. So European degree or European syllabus is something that's most commonly used outside of India, or it is the most closest one to Indian syllabus. So let's say Russian countries, Caucasian countries, Europe, all these countries use it because of certain advanced benefits that they had during the World War time, or let's say the advancement of anatomy access they had at that times. So that's why this syllabus is more followed and widely accepted around the world. I myself went through it, working in US and everything definitely helped me. So this is how I can, address that. Any other question?
Yeah, one more question is that after completing this 6
Go ahead,
years, within
Yeah, please.
instead of going India, if you are in Armenia, you have to do the licensing exam of Armenia, right? Or you have to do both in India also,
No, you
or
don't
in
have to. If you want to work in Armenia, no. So you just have to do it in India. So if you are planning to go back to India, the process starts with writing the NEET exam before traveling to Armenia. So when you are going to join the first year, you have to write NEET. So if you are a student who didn't write NEET, that's also okay. You can still join in Armenia. So just to understand what is NEET, NEET is an exam that is done as a preliminary examination before traveling out of India for students who have plans to come back to India. So it is not required for students who are planning to go abroad and work, but I highly recommend you to attend NEET, because in the end of the day, if you're going from the home country of India, someday you might go back, you might need to practice. So I highly recommend it. And if you don't write the NEET yet, there is still one benefit. So what you can do is, once you join Armenia, you have a time window line of 1 year. You can still write NEET exam. So even if you didn't write NEET, you can still get into the NEET exam after joining. So there's no issue with that. So what our students do is, like, they travel during May or June, whenever the exam is, to Dubai or to India, write the exam and come back. So that's something is possible. So saying that, once you finish your course, you will have to do an internship of 1 year according to the current rules of NMC. You will have to do an internship of 1 year. With that 1 year internship, you can come back to India and you can start your NMC preparations, your exit exam, and all that. And once that's done, you can straight go to practice. Or like most of the students do, they go abroad. They try to get into Germany, let's say Germany, Spain, UK. So whichever is your choice. And that I would highly recommend to think about it once you're in the third year. So there is time. Don't jump in, because the world is changing, opportunities are changing, and there is a lot more for you to explore. Because right now, things that is provided by your teachers and parents. But once you are in, you are going to talk with subject experts. You are going to talk with your professors who are doctors who have done this. And the process are really awesome. I have to put in that. And I think we are the 12 in the midnight or 2 in the midnight asking a doubt, and they will still reply. And that will be only UTMA that you can find. The access with teachers is very simple, unlike in India or other countries. You can connect with teachers on WhatsApp, with Facebook, Instagram, wherever it's convenient for you. And as long as they are available, they'll be answering to you and reverting to you. So if you have doubts, there is extra tuition available for the students, and there is extra examination chances that you will be getting. The communication is very simple. The university is very, how do I say, transparent. So it will be really easy for you when you're going there. And like I said, getting attention is very important. Going to universities where there is an admission rate of 1,000 students in a year, you can imagine what's the kind of attention you are going to get, especially considering you are going to do medicine. So we have a batch system of making 15 to 20 students maximum in a classroom. That's to make sure the teacher have access to each students individually and can assist them and assist them accordingly. So I think that can have some more insight of it. Any other questions, folks?
Oh yeah. Hello. Hi.
Yeah,
With regards to the NEET exam, like, is there any cutoff?
You mean
yeah, like,
yeah, there
like,
is definitely.
oh, okay, okay.
There is no requirement for NEET to have an admission in UTMA. The only requirement for NEET
No,
is
if
if
they
you want.
if they want to go back to India and practice there, like,
Oh yeah, it depends on. So since India is pretty caste-based, there is a different caste-based cut of marks for different NEET. But I believe 130 is the minimum that you should score. So usually what you can do is you can just focus on biology and you can still get that mark. So if you are going to focus on, let's say, physics, chemistry, or biology, it depends, how much of you can study physics or how much of you can have focus on chemistry. But if you are looking at the bare minimum, I can say you can just focus on one subject and still earn it. So that's about NEET.
What who don't like, comes to like 130 or, who don't pass in NEET, like, they are
You can
still
still
eligible.
give it a try next year. That's a
Next
benefit
year,
of it.
okay.
Let's say,
So
yeah, you can
they
still
can even write
try.
after 6 years, you mean?
No, not after 6 years. You have to do it in the first year. Like once you join,
First year, right?
you have one window time. Yep. Before the second year, you have to attend that.
What if they don't, they don't pass, before second year? I mean, it can happen, right? I mean, it's just,
but
it's just an instance.
unfortunately, the system is the system, made by the government and the Medical Council of India. I can't overcross it. So the system says you have to have the bare minimum mark, and if you don't have it, then I really recommend you to reconsider the course as well.
And
because if you can't,
what about for the UK? Like, is there any exam, like,
it's going to be really tough. Yes, sir. Please. Sorry.
What about those who come from UK?
Oh yeah, there is no worries for that. We have UK citizens who are currently studying. So for them, it's the same. You don't need NEET. If you have any requirement that's based in UK, you can still access it and you can study. And
Perfect,
if you
okay.
pass out, meet your regulations in the UK, you are eligible to work there. So that's simple.
Perfect. Thank you.
Thank you, Mr. Anis. Anyone else? Feel free. If you are not feeling comfortable, you can put it in the chat.
Yeah, one of the most popular questions that parents usually have, one is regarding the living cost and regarding the safety. Especially parents, when they're sending their students abroad for studies, like they'll be very much concerned about the safety, the food that they're gonna have, the hostel facilities, all those things. So can you please give everyone a brief about first of all the safety as well as the living cost, because they might have questions about that.
Definitely. So just simple as that, we have a system where considering the students are coming to the country for the first time, let's say 17, most of them will be 17 or 18 years old, and it's definitely not easy because I have seen my own parents having the difficulty sending me where I was acting as if I am a grown-up. But going to Armenia, what you should consider is, of course, you are in a new country with new regulations, etc. But there's a huge Indian community that's already residing in Armenia. So the country is familiar with our people. They know the culture. So it is safe for us. They do consider us as part of their culture already. And it's very helpful for you in that aspect compared to the time that we went, back, let's say 10 years back. So safety is highly safe. I can say it in simple word. And to make sure it is more assured, we make sure the students do not go out of the hostel after 9 o'clock in the first year. So we have a cap system where they have to come to the office, let's say to Ms. Taguhi or to Mr. Ashok. You have to go to their office and inform them if you're going out of the city. So we know your safety is assured and we are going to keep a track on your travel. We are going to make sure, like, if you need support, we'll be coming up to you. We'll be coming even at night times. So all those things are something that is unique about UTMA and the team that works. We have the ISWA Cultural Center that's going to be supporting you. So that's another thing. If you are not feeling comfortable enough, to reach out to our office, students can have that. You can, of course, contact one of the senior students who are going to support you with the entire process, and they'll be taking care of you as well. And about food, of course, our people cannot survive without our Indian food. So definitely we have an in-house team making you Indian food from north or south up to your taste. We have a mess system that's providing food for 2 times a day, let's say in the afternoon and in the evening. So parents ask, why not in the morning? The reality is most of the students are very lazy to wake up and they miss out the breakfast and they just run to the class. So we had a lot of food going on waste and we decided, okay, maybe the students can get something of the snacks from the university. So you can always access breakfast in university cafeteria rather than depending on the mess in the hostel. So that's about that. And Shasin, what else did you mention? Food, accommodation, safety?
About the living cost.
Oh yeah, living cost, definitely. It's something that comes around $300 per month compared to, that's with the accommodation, the food, and of course, you should have something in your pockets, to go around. Let's say you want to take the bus or you want to do something. So usually one thing I have seen with consultancies, like just to show to parents the living cost is very low, they will only mention about the food and the accommodation. So what happens there is the student have to suffer later because they don't have access to the basic transport or anything else. And that creates a lot of issues for the student, that will give them emotional issues there. And we have to consider the psychological aspect as well. So for having a comfortable and at the same time having a very relaxed education system, we have breakdown even our classes for students in specific way. So the teachers will be supporting you with daily PDF copies, or let's say they will be reaching out to you with electronic copies, or even give you print copies of your entire topic every day. And you don't have to carry on too much books. That's the best part of it. You basically need to have 3 or 4 books that will be provided by Smartzett, like the list of them. And after that, the everyday topics are provided by the teachers. And let's say classes, that's something you have in your mind, right? Like how many hours of classes are you going to have? Let's say the first year and second year, you are going to have from 3 hours to 5 hours maximum. And it's only Monday to Saturday. You're not going to have Sunday and Monday to Friday. Saturday, Sunday classes are not there. But there are times when you might need extra tuition or there might be need of extra classes. They might put it on Saturday very rarely. And you will have vacations, let's say 2 months of minimum. So 10 months you have classes, 2 months you will have holidays. And there will be winter break as well of 15 to 20 days as well. So Saturday, Sunday classes are also not there. So there is a long time frame. After the classes, you have a lot of time, but considering you can study, put at least 3 hours more of your time. You can definitely pass. If you are looking at something more than just passing, definitely put in a little bit of time, and you still have, let's say, around 15 hours. And there you can sleep, you can go out. There is always places where you can visit. The university is very supportive. The Student Welfare Association is going to support you. And yep, the entire process is pretty open and clean. More? Good? Deep? Does it sound
Yeah.
good?
I think everyone has taken notes from this. Yeah,
Sorry,
Deep,
one second,
please.
Shaswin. Yeah,
Yeah, one last question
Deep,
about
please. Sorry.
what about dental students?
Oh yeah, we have BDS section as well. So just so you understand, in India, our BDS program is not recognized. But if you are planning to work in UAE and in other countries, it's highly recommended because we haven't applied for BDS for India. At the same time, it's not something students from India usually consider to go abroad and study. But students from UAE, we have lots of Indians from UAE who come to study BDS program in Armenia with us. So that's it, and it's super easy. Countries where you can, get more insight and more hands-on work for teeth and cosmetology. And like Turkey, you have heard Turkey and some countries. This Armenia is also one of the best in the world for having cosmetology, dentistry, etc. So yeah, opportunities are high in that those areas.
So it's also like similar European curriculum only. It's similar
Same.
to
Similar to everything is same except you have 1 year lesser. You have only 5-year program for dentistry. Everything else is the same.
Okay, which includes the internship, right?
So sorry, I couldn't hear you. My network seems to have a problem. So please, what was it?
5
He is
years
asking
include the internship.
You don't need internship if you are not looking to come back, but if you need internship, there will be an extra year, because you should understand internship is not part of a curriculum, but it is a part of a system that requires you to have some experience before going to a certain country, practice. So always remember, people who are letting you know it's a 5+1 program, NMC, according to NMC rule, it's not legal. You should have a 6+1 program, or let's say 54 months in one single country, and there is a requirement from NMC. There is a lot of programs that I have seen students going in and falling in trap. Recently, I think it was the Caribbeans. One time you connected me with a set of students, Yasin. I remember it was from Caribbean.
Yes. A bunch of
Yes,
students from
yes,
West Indies, I believe. Yeah.
Yep. So they
Yeah.
got stuck, and the program was assuring them that it's a US program, etc. You can practice in the US, but unfortunately, that's not how it works. So if they are showing you one product and they are marketing another country, please stay away from there. Very simple. For example, if they are showing you the Caribbeans and giving you opportunities in the other place, definitely not easy to work that way. So if you have opportunities everywhere, yes, that's good. But if they are giving you suggestion like you can do your internship in the other country, of course you can do your internship in any country. That's not just for there. Even a student who is studying in UTMA can do the same.
So basically,
So
they
internships
are
are global, but the requirement for NMC is that. Yeah, sorry, go ahead. Yeah,
yeah. So in all countries is this degree valid? The dentistry as well as
everywhere.
MBBS.
So the program is valid everywhere as long as you want to practice. Let's say usually people from India, they want to go to US, Germany, Spain, UK, Canada, etc. Right? So all these countries, it's valid. Just so you know, and you can always choose it. Like I said, don't jump in now where you want to practice in the future. Go ahead with some
Yes, yes, sir.
time. Once you know your bachelors are good, then jump in. Okay, that's a high recommendation. Anything else, folks? Doubts, queries?
I have a question from Mr. Muhammad. Actually, he's traveling in the metro, so he's not able to, turn on his mic. So
Okay.
he had a question where can international students work part-time while working?
Yes, you can definitely work, but I highly don't recommend it because considering you are going to be a medical student and you have a lot to study, but at the same time, you can do that. There are students who do, sorry, so there are students who do the part-time jobs. We have Mr. Muhammad, I think your microphone is on. Thank you. So we have 60 students also who do the part-time job. For example, they work in call centers, they work in casinos, online casinos, they work as delivery boys. All that is there. You can definitely work, and there's no limit for a certain amount of time. That's something special about Armenia. You can work part time as much as you want. And there are students who I highly, have seen working and at the same time studying and acing the, subjects. But I don't recommend it for all. But if you are one of that student, yeah, you can.
Yes, Mr. Shabin Nazar, I wanted to add something that in the first year, like it's not recommended because you have to be concentrated on your classes and get acquainted with the new culture, new people, with the country. So after first year, if you see that you have the need, for sure you can apply for some part-time jobs and combine your education with work.
Yep, I definitely agree with you because most of the students are thinking about working and it might be not finishing at 9, so
It
definitely not safe.
distracts them from studying, yes, for sure.
Yep, not safe for your education. So definitely, I agree with you, Ms. Tawi. Anything else you want to add? Because most of them will like to hear your hands-on experience, with them. Anyone else? Questions?
Yeah, so Mr. Muhammad, he had another doubt about the medium of instruction. So yeah,
It is
medium of instruction is completely in English. You can carry on, doctor.
Yeah, thank you. So the medium of instruction is in English, and of course, the medical terms are always going to be in Latin internationally. So that's there. And Shasin, I think it's very important for you to share the doms.org, wdoms.org website link once you are talking to the parents directly, because I think the parents can verify this online. So there is a World Directory of Medical Schools link. Shasin will be sharing it to you during counseling. So
Yes,
in
yes.
that link, you can always see, the list of universities who is accredited and what's their medium, how many years are there, which all countries they are recognized. So yeah, all those details will be shared by Shasim once you contact him.
Yes, yes. I'll do that.
Any other
So
doubt, folks? Sounds good. Okay, so if you have any doubts, feel free to connect with one of us. We'll be happy to, connect with you. If you need a personal session, I think we can definitely arrange that. Just let us know in advance so we can be available in, a mutually convenient hour. And rest, over to you, Shaz.
yeah, so anyone has, if anyone has any question, it's your time to shoot. It's a good opportunity for you, especially the parents and the students present here. I think someone's connecting now. Someone just entered the meeting. Yeah. So apart from the things we've discussed, if you guys have any doubts or need any kind of clarification about, anything about the course, the the living cost or anything like that, you can directly text me or any of our counselors here. Excuse me, Mr. Yeah. So we'll be taking care of that part. We will be definitely helping you with that. The as I mentioned earlier, all the admission process, right from the eligibility assessment. Yeah, Dr. Shabin, can you please let the students know about the eligibility process, because that is one also one of the most
Oh, yeah,
popular questions
definitely,
we're going to get.
definitely. So the eligibility is very simple. As long as you are having at least a 50% of marks in physics, chemistry, and biology, we do accept you. But we highly recommend you to have furthermore scores. But definitely, we don't have a limit for dreams. And we have seen students who come with 50% and still acing in their exams, because some students, they can be going through a difficult time during their 12th class. It can be a family loss. It can be something personal. But we do give the opportunity for all the students who at least have a 50% of mark. We will need your documents such as, your 10th and 12th documents that's apostilled. You can also have a pre-booking. If you are very sure, you can have a 12th at least 50% mark. We can give you a conditional offer letter, and you can book your admissions as advanced as now. And yeah, basically that's it. Your passport copy, photo, yeah, all those documents. That's it. It's very simple, folks. Like, not going to complicate it. It's very easy to get the admission process compared to the processes that people just expand and extend just to make sure they get something from it. But still, I just wanted to make sure it's a simple process.
Just give the right documents, submit it, and
That's
then
it.
you're good to go.
What
And
about
especially from
academic?
yeah,
Sorry to bother you.
Yeah,
What
no,
about
no.
the
So
carry on.
academic year starts? Like, what
yeah,
about
it
the
will be.
intakes?
The intake will be only one intake. It will be September intake. So we'll be starting
Okay.
classes in the end of September or in the first week of October, depending on when the Ministry of Armenia allows us to start our classes. So there are times when we look at a high number of students that comes to Armenia, and looking at the hospital cycles, etc. It can go from the last week of September to the first week of October. And admissions usually close down during June or before June, because as long as the students are interested and we have only 120 seats that we focus on, it's pretty fast that it closes. So we highly
Also,
recommend. Yeah, sorry.
I got one more question. Like,
Yeah, please.
what about internship? Like as you said, like 5 years course, and if they don't want to do internship, and if they want to come to UK, and they can still practice here, like after writing their exam,
Yeah.
like
Yeah.
so they
So
don't
the
really
6
have
year
to do
course,
the internship. It's for them. Like if it's a choice.
it's a
If
choice. It's definitely a choice. And is it for BDS? For BDS, it's 5 years, and for MBBS or let's say general medicine, it's 6 year course. So after your course, you are free to choose. If you want to do an internship in the country.
it's up to
So
the person, okay, student,
yeah, in
okay.
UK, you can do the internship. So for India, there is a new rule. The students from India have to do the internship in the country where they are doing their degree. So that's the
Oh,
only
I mean,
requirement for Indian students, not for people who are focusing on UK or other places.
also like because like I mean each country they're revising their rules. So what
Mhm.
if they change
So,
the rules like
so
after
the
a certain
rules,
times? Yeah.
the rules will be like this. In the year, whichever year you are going to join, that's the rule that will be
Oh, okay, that's applicable. Okay, understood. Okay.
2024. If you're joining, the rules that's available the moment when you apply, that's the rules that's applicable for you. So
Okay.
it will be continuous until you pass out and you have your exams and forward.
Okay, perfect. Thank you.
Pleasure.
So a few of you have joined just now, like
Oh,
it's
wow.
been almost 45 minutes since the session started. So to anyone who has joined now, like 5-6 minutes ago, if you guys have any doubt, just shoot.
and they might be a little shy, so you can definitely reach out to them personally.
Yeah, you can just send a message or
So if you could
put
all
it in the
just send
chat
your
box.
number to Mr. Shasin. Yeah, you can just put the numbers in the chat box and they'll be reaching out to you, because we are almost done with the meeting, because we are not planning for more than 45 minutes or an hour scheduled. Oh yeah, I think sounds good. And yeah, like I said, if there is any further doubts and if you want to talk, feel free to reach out to us. If you want to talk to one of us, to me or Mr. Taguhi, we can definitely connect and have a one-on-one session as well with your team, and we'll be happy to assist you all. Okay, and I look forward to seeing you all. Deep, see you in Armenia, hopefully, right?
Yes, all right, I think.
Also.
Thank you. Thank